Our next speaker is someone who is also no stranger to community health centers. Deborah Enos is the president and CEO of the Neighborhood Health Plan, the state's community health center-based HMO. Deb works hand in hand with health centers and the Massachusetts League of Community Health Centers to provide the best care to the vulnerable patients we serve. Under Deb's leadership, NHP has provided significant investments in health center programs and our infrastructures. And we value our unique partnership with NHP and its president and CEO, Deborah Enos. On a personal note, I've had the distinct pleasure of working with Deb on the board of NHP now for almost 10 years. And I look forward to another 10 years perhaps. So Deb.
Well, good morning, everyone. As you heard, I'm Deb Enos, President and CEO of Neighborhood Health Plan, and I am absolutely thrilled to be here with you today as this marks the first round of grant awards through the Partnership for Community Health. I have to say, on a personal note, it is so rewarding to think about this concept as an idea and to see that it has come to full fruition. And while you've heard from Gary and you're hearing from me and you will hear from Jim, I want to acknowledge that within each of those organizations are very, very dedicated folks, many of whom are in the room today, that really have worked very hard to make this program come to fruition, and I'd like to acknowledge and thank them for their help. This is really the first step in a commitment to enhance our support for the community health centers that care for so many of NHP's members. As you've heard, over the next 15 years, the Partnership for Community Health will provide up to $90 million in grant funding to community health centers. All 49 community health centers that are members of the Massachusetts League of Community Health Centers are receiving grants, including our colleagues here at Greater Lawrence Family Health Center. NHP and community health centers have a very special relationship. NHP wouldn't be here today if we wouldn't be able to serve our communities if it weren't for the community health centers. After all, the community health centers were those who created NHP back in 1986 when the Massachusetts League of Community Health Centers, and our own Mr. Jim Hunt, and the Greater Boston Business Forum for Health Action identified a new challenge to provide better access to health care for the underserved populations throughout the state. That challenge became our mission. From our modest beginnings in the Fields Corner neighborhood of Dorchester, serving the members of the Boston Health Plan, we quickly embraced our role as a community member, service provider, and leader. Since day one, our shared commitment has been to promote the health and wellness of our members and to help ensure access to equitable, affordable health care to the diverse communities we serve. The grants we announced today will allow community health centers the ability to develop and launch measurable programs that enhance outcomes, service, efficiencies, and quality of care. During this first phase, projects will specifically focus on expanding programs and improving infrastructure. For example, some of the health centers will use their grants to develop patient portals and dental electronic medical records. Patient portals can include providing patients with electronic access to their own health information, like test results, medication lists, and medical appointments. This allows patients to begin to take a greater role in the management of their health care. And dental electronic medical records will provide healthcare providers electronic access to retrieve or modify patient dental records quickly and efficiently. These projects are just a few examples of the work that community health centers are engaged in to improve on patient experience and the delivery of care. Our mission at NHP continues to be at the forefront of our organization, and the community health centers continue to be our backbone, serving as true partners in our ability to achieve and sustain that mission. We look forward to the work ahead and our continued partnership, as we deliver on the promise of high-quality, accessible health care for all. Thank you very much.